It's Monday, and I'm live from Boonville, Missouri. Nice day. Supposed to get thunderstorms. This is the weirdest weather. Lots of rain in the last 2 weeks. So, Boonville's pretty green right now. More mowing. Usually in Oklahoma, you don't have to mow this time of year. I don't know how Oklahoma's doing as far as rain. So what we're going to talk about this morning is serotonin. Probably a lot of people that join this or watch this are on a selective serotonin reuptake inhibitor. And I think later on this week we'll do the brain chemistry of depression. So lots of people are on Prozac type stuff. Zoloft will go through the list. And what they're doing is trying to decrease the reuptake of serotonin in order to work on their depression. So you're thinking, okay, well, I know the SSRI term, most people do, stands for selective serotonin reuptake inhibitors. So what does it do? What is serotonin? Why is it important, etc.? So really, serotonin is a neurotransmitter, closely related to norepinephrine and dopamine, and actually is a precursor to melatonin. So if serotonin is low, your serotonin levels are low, most people have a sleep disruption because they don't have enough melatonin. We'll go through the 7 warning signs, sort of. I mean, I don't think you're not gonna drop dead of a serotonin low level. But most people equate serotonin with depression, right? So it's the other name for it is the chemical name is 5-hydroxytryptamine or 5-HT. It's kind of an unfortunate way of saying that because 5-HT is also 5-hydroxytryptophan, which is a supplement to help raise serotonin levels. So it functions as a neurotransmitter. So if you're in my physiology class at State Fair, we spend a lot of time talking about synapses and neuron to neuron communication, and that's how that works. So it's signals between nerve cells. So most people are aware of the central nervous system, sort of aware of the central nervous system functions of serotonin. So serotonin is a mood regulator. It's called the happy chemical for that reason. So it stabilizes moods. It doesn't, and the SSRIs do not stabilize moods as much as you maybe have been led to believe. So Prozac was huge. I think it's almost 30 years old now. But Prozac Nation, you've heard that term, and about how many people were put on Prozac back in the I guess it'd be the 90s. Okay, so it also helps with memory, but it has a lot of other important jobs in the body. And so most of the serotonin, most people think it's in your brain, but most of it's actually in your gut, not your brain. And that's actually where it's made. So your intestines produce almost all of the body's serotonin supply, and it's also required in the intestine to help promote healthy digestion. Also helps with sleep, like we talked about. It's a precursor to melatonin. It has to do with sexual function, libido, and sexual desire. It has to do with bone health along with vitamin D and calcium and estrogen. And it's also involved in blood clotting. So it's released from platelets. Okay, so there are a few ways to balance serotonin. We're going to talk about those. And of course, we're going to talk about diet and exercise, of course. So what does it regulate? So moods. Okay, so it's really, that's kind of the starring role of serotonin in your body. So it helps regulate your mood. It's also known as the feel-good chemical, although I kind of think dopamine, which is, not a precursor, but it's one of the co-neurotransmitters, dopamine hormone, I should say. So it's often the target, serotonin, as a neurotransmitter for the medications used to treat depression and anxiety and other mood disorders. And so the selective serotonin reuptake inhibitors are the pharmaceutical medication used, and they've been used even before that with the tricyclics. We'll go through all that. For digestion, you've got to have serotonin for normal blood function, bowel function, not blood too. But it reduces your appetite to eat, so it's a satiety neurotransmitter. It takes 20 minutes for your brain to realize you're full. So one of the problems I have with high school cafeterias is one, they give everybody a bunch of carbs, these kids, which of course makes you tired. So about 2 o'clock, or 1 o'clock, 1:30, all the high school students are wanting to take naps. But also they only give them 22 minutes to leave the classroom, go to the cafeteria, eat, and get back to the next class. That's too fast. So theoretically, you should take 20 minutes, if not 30, to eat so that you don't overeat, because that neurotransmitter will tell you that you're full, but it takes 20 minutes. Okay, so if you eat something toxic or irritable to your gut, more serotonin is produced, and that extra dose helps move unwanted food along to expel it from your body at a faster rate. So there is such a thing as too much serotonin. We'll talk about serotonin syndrome at the end. So too much serotonin can make you nauseated. And so there are certain drugs that are used for nausea and vomiting that are targeting specific serotonin receptors. That's how they work. Okay, next function, sleep. The exact nature has been debated. It's believed to influence when and how well you sleep, how much you sleep. It does not regulate those tasks alone. So dopamine also plays a role in sleep. And then melatonin, of course, is critical to proper functioning of the sleep cycle, and your body needs serotonin to make melatonin. So not enough of that can affect sleep patterns and the quality of sleep. So the parts of your brain responsible for regulating your sleep cycle have serotonin receptors. Okay, so that serotonin-melatonin relationship imbalance can lead to sleep disruption and insomnia. Also a common problem with people that are being treated for depression. As far as blood clotting, anytime you have tissue damage, cuts or whatever, trauma, the platelets release serotonin to help heal the wound. So when I talk about platelet-rich plasma, which I've always used for cosmetic stuff, you are counting on the platelet to release serotonin and other growth factors to heal a wound. Serotonin vasoconstricts arteries, the small arterioles of the circulatory system, to let blood flow slow down to be able to deposit trauma healing properties of what's carried in the blood. So bone density, so that's blood clotting. So serotonin has something, has a big part to play in blood clotting. So bone density, if you're, and this isn't the only thing, of course, because vitamin D plays a part in this, estrogen plays a part in this, but it appears that serotonin levels, if they're low, influence bone density. So, and not low, sorry, high circulating levels. So that's another, I have that backwards. So if your serotonin is too high, like I said, we'll talk about serotonin syndrome. But if you get it too high, those people usually have higher circulating levels of serotonin with lower bone density and the risk of osteoporosis. So one of the things with SSRIs is that SSRIs can decrease bone mineral density because they're blocking the reuptake of serotonin in the synapse. So the serotonin is released from the dendrite toward an axon into the synapse. That's between two nerve cells. And the receiving nerve cell has receptors for serotonin. So if there's more serotonin there, it gets reuptaked. It's reuptaked, is that a word? That's a reuptake of the signaling neuron, right? And then it's recirculated and can be used again. So that is the kind of the goal of an SSRI like Prozac and Zoloft, is to block that reuptake. Okay, but if you get too much, you lose some bone density. Okay, sexual function. So alterations of mood is what everybody thinks about with serotonin, but it does have the influence of frequency, or it can influence the frequency and intensity of the sexual feelings you have. So certain antidepressants lower your libido. Okay, so elevated serotonin levels have been associated with a decrease in sexual desire. So too much of a good thing makes kind of not such a good thing. Okay, and it may be related to its relationship with dopamine, so the other hormone chemical that we talked about probably 6 to 8 weeks ago. So women in 2000, well, there was a study in 2017 in women that had a diagnosis of hypoactive sexual desire disorder, indicates that the symptoms of the condition are associated with increased serotonin activity, which leads to a reduction in dopamine activity. And remember, dopamine is the hormone that is always instrumental in addiction behavior. Okay, so that kind of surge of excitement that people get even from shopping is from dopamine. Okay, so what are the causes of low serotonin? Well, it's multifactorial, so there's more than one reason that they occur. So that by itself, just a low serotonin level, does not necessarily cause depression. And we'll talk about the percent of people that actually respond to SSRIs. Okay, so it typically occurs, low serotonin, for one of two reasons. Either you don't have enough of it, or it's inefficient use of the serotonin that you are making anyway. Okay, so in the first scenario, you have lower levels of serotonin because your body's not producing enough, and that may be because of other factors such as nutritional and vitamin deficiencies. For example, low levels of vitamin B6, which is pyridoxine, and vitamin D have been linked to lower levels of serotonin. Okay, tryptophan is an essential amino acid that's involved in serotonin production. It's an essential amino acid, which means you don't make it, you have to eat it. So you have to get it through your diet. So if you're making serotonin and not using it effectively, it may be that you don't have enough serotonin receptors in your brain, or the ones that you have are not working well. So maybe they break down and absorb serotonin too quickly. Okay, so depression, and we'll do the chemistry of depression coming up. It's kind of a interesting little thing. So increasing how much serotonin is in the brain appears to improve communication between brain cells. And then that in turn lifts your mood and reduces symptoms of depression. Okay, so clinical depression is when I was training, clinical major depressive episode was defined as 3 months. So at 3 months, you got something else going on. Maybe not just acute depression, so it's major depression. Okay, so SSRIs, some of the most commonly prescribed pharmaceuticals for depression in the world. They reduce the symptoms of moderate to severe depression. So notice I said moderate to severe, and actually they work the best on people who have severe depression by increasing serotonin levels in the brain. Okay, so before they can send another signal, they have to reabsorb and recycle the neurotransmitters called reuptake. So SSRIs make more serotonin available in the brain by blocking that reuptake process. So the SSRIs, and then we're going to talk about SNRIs. So SSRIs are the ones you've heard of: Celexa, Lexapro, Luvox, you might not have, Paxil, Prozac, and Zoloft. All have pretty much the same mechanism of action. Then there's serotonin norepinephrine reuptake inhibitors, SNRIs. Okay, so they work on both serotonin and norepinephrine. So norepinephrine has been implicated in depression. So these medications are called dual-acting antidepressants because they work on both of those neurotransmitters. The ones you've probably heard of are Cymbalta, Effexor, and Prestique. Sorry, said that wrong. Okay, then the tricyclics, the older ones. So there's two older classes. One, the tricyclic antidepressants and the monoamine oxidase inhibitors. Lots of warnings on medications for people taking monoamine oxidase inhibitors. So most people, I don't think I've ever prescribed ever a monoamine oxidase inhibitor. Most doctors stay away from them because of interaction with other meds. Okay, so tricyclics are still used, and specifically amitriptyline, which is Elavil, is used for chronic pain syndrome. Works great, low dose, 25 milligrams at bedtime. I've used that a lot for chronic pain syndrome over the years. It's an off-label use, like we talked about last week and a half ago, off-label use of FDA-approved medications. Amitriptyline for pain is one of them. And really, if amitriptyline was put through the FDA today, it would probably be labeled as a pain medication. So they block reabsorption of serotonin and epinephrine, so that effectively increases the amounts available in the brain. So the ones that you've heard of, I'll use the trade names. So anafranil, the ones that you would have heard of, Elavil, norpramine, Pamelor, Cinequan, Tofranil, and Vivactyl. Those are the kind of ones that most people have heard of. The most common one people have heard of is Elavil, and that's amitriptyline. So the monoamine oxidase inhibitors, not even going to talk about them because I'm looking at all of these, and I've never prescribed any of them, and I've never seen anybody that are on these, so they're just not really used that much. Okay, so what we're going to do is talk about 7 warning signs of low serotonin levels. Okay, so the brain neurotransmitters that we've talked about, epinephrine, norepinephrine, serotonin, there's others, and it's a large part of what makes us us. Okay, so they're wholly responsible neurotransmitters for all the communications that take place in the brain and the body. So signals from the brain, and the neurotransmitters relay those neuronal signals from the brain that allow you to operate properly and maintain homeostasis, which first day of my human physiology class in 2 weeks. Homeostasis is the study of human physiology, or human physiology is the study of homeostasis. The other thing is we don't really know, does depression result from low serotonin, or does depression cause low serotonin levels? That's never really been elucidated. So here's 7 warning signs. First off, serotonin is an inhibitor neurotransmitter. So that's how it stabilizes mood. It balances any excitatory neurotransmitter firing in the brain, regulates carbohydrate cravings, sleep cycles, pain control, and digestion. Also, low levels are associated with decreases in immune system function, which is kind of a big deal during this pandemic. We keep talking about things you can boost your immunity with. Not just serotonin, but okay, so number 1 of 7, craving sweets and starches. Okay, they indirectly impact serotonin levels, and so it's people that have lower serotonin levels tend to have cravings and yearnings for food that are rich in carbohydrates. And we've talked many times about the problems with carbohydrates and insulin resistance and sugar control. So when you ingest carbohydrates and more tryptophan, that becomes more available because of carbs. So in turn, the brain and body produces more serotonin. And many foods that are high in carbohydrate contain gluten. And we'll talk about gluten insensitivity sometime down the road as well. So gluten, carbs are addictive. So is gluten. And that's part of the harbinger of weight management. So I just got a message from a guy that's starting his super skinny shot today, and I sent him some dietary recommendations, specifically cutting carbs out. I talked to a guy yesterday He just did that, and he's on testosterone, so his testosterone is now optimized. And since April 29th, he's lost 24 pounds. And pretty much all I told him to do is cut sugar. He took it a little farther and cut pretty much most of his carbohydrates out. He's on the road a lot. His favorite thing to drink was sweet tea. So I made him stop doing that. So he's traded that for water. So 24 pounds since April 29th without the super skinny shot. He just did it on his own and we got his testosterone better. Okay, number 2, cognitive impairment. So serotonin is important for your thinking, normal cognition. And so proper levels gives or improves cognitive ability and may help correct defective cognitive functioning. Okay, it also plays a significant impact on memory. So people that have lower serotonin levels have problems with memory consolidation, which is involved with your hippocampus, and you form your long-term memories. This is a whole section in my human physiology course. You form long-term memories while you're sleeping. So if you're disrupting your sleeping with serotonin problems and melatonin problems, etc., then you have difficulty forming long-term memories. You might keep your short-term memory, okay? But being able to consolidate that and remember things is one of the functions of serotonin involved in your hippocampus, part of your brain. Number 3, anxiety. So medications that boost levels are usually prescribed to people suffering anxiety, okay? So brain imaging has shown that people with high anxiety have limited serotonin levels in their brain, and that's involved with impulse and emotional control. So they have difficulty with impulse problems. Noting also in anxiety that there are 3 other neurotransmitters, gamma aminobutyric acid or GABA, dopamine, and epinephrine. So they all work together. You know how your body works. They all talk. Everything in your body talks to each other all the time. Number 4, fatigue and exhaustion. Okay, so serotonin has a marked effect on energy production. So if chronic fatigue patients have been tested and found to be insufficient in their serotonin levels, when they're replenished, it's common for those that have chronic fatigue just from that to notice an increase in energy levels. And I've told you before, the most common, if somebody asks me what's the most common complaint you hear through your entire career, it's fatigue. Fatigue. So I put, when I was coding stuff as a doctor, I would code fatigue on pretty much everybody. And then we would come at their fatigue from several different angles. So feeling fatigued or exhausted can be from a whole bunch of stuff. But chronic and long-term fatigue seems to be associated with serotonin, lower serotonin levels in the brain. Again, like depression, is the serotonin being low causing the fatigue, or is the chronic long-term fatigue causing lower serotonin levels? Number 5 is digestive difficulty. So there's a link between irritable bowel syndrome and inadequate levels of serotonin. That's an easy fix. You take 5-hydroxytryptophan this is one of them you kind of got to have some help, either a health coach or a health professional, because you can take too much and get too much serotonin. We'll talk about that. So irritable bowel syndrome responds to improving serotonin levels. Very, very common issue. So digestive function may return to normalcy. So irritable bowel is kind of alternating diarrhea and constipation. Seems more common in younger women. I took care of a lot of menopausal women, but irritable bowel syndrome is not quite as common as it is in younger women in their 20s and sometimes teenagers. Number 6 of 7 is insomnia. You probably figured that out since serotonin is transformed into melatonin. And so if your melatonin production is impaired, it's like a domino effect on your circadian rhythm. So that's all off kilter. And specifically with this, it's the ability to fall and remain asleep. And there's different reasons for asking that, because when somebody has insomnia, I ask them, can you fall asleep and not stay asleep, or can you not fall asleep and then you sleep, or can you not fall asleep and then you wake up, and why is that? What are you thinking? All that. So sleep is kind of an interesting thing to try to deal with. Changes in libido is number 7. So libido is the sex drive, and low levels are directly linked to an increased desire to have sex. Okay, so that is why if you increase your serotonin levels with SSRIs or tricyclics, you may actually have a negative effect on your sex life. Okay, so so further, you can also get productivity and reduction problems that can affect your attitude, physical capabilities, all related to sexual activity. Okay, all right. So, how do you improve your serotonin level? There is a way to measure serotonin. And if I find one that's reasonable, I'll put it in the comments so you can, if you want to do it, you can do a blood test on yourself. Serotonin, ways to naturally improve serotonin. So without taking Prozac and all that stuff. So one is sunlight. That has to do with vitamin D, although I don't think sunlight really gives you as much transformation of raw vitamin D to 25-hydroxy vitamin D. That's the theory. Because people, I've told you before, people that have really good tans have come in with horrifying vitamin D levels, and we have to supplement them. I'd say 90% of the people that I've done a vitamin D test on are under 30, which is insufficient. May not be low, but it is insufficient. So sunlight is involved in that. Exercising, okay? So exercising raises serotonin levels. So does meditation. And we'll talk about, we talked a little bit about meditation on the Health and Wellness series last Thursday evening. I don't know as much about meditation, although I've done it. I don't know about as much about meditation as my mental health professionals do that are on that podcast. Okay. So you want to lay off simple carbohydrates and sugars and starches. So you need protein. Okay. You can get tryptophan 5-HT as a serotonin supplement. You should take B complex vitamins since B6 is involved as well. And interestingly enough, getting a massage raises your serotonin levels. So even a 20-minute massage. So that was done as a study, pre and post massage. Okay, so let's talk a little bit about overproduction of serotonin, so serotonin syndrome. And so the side effects of SSRIs theoretically are sort of a little mini serotonin syndrome. So the side effects are dry mouth, nausea, insomnia. So see, too much of a good thing gets you back into the insomnia thing. Headaches, jitters and nervousness, weight gain, diarrhea, sweating, sexual dysfunction. So again, too much of a good thing. So in your food, to improve your serotonin is eggs, nuts, seeds, turkey, and bananas are also high in serotonin. The problem is you can eat bananas all day long. You do get potassium. The serotonin doesn't cross the blood-brain barrier. So a lot of people say bananas, but that technically doesn't work. And turkey, that's the common thing. You get sleepy because of the tryptophan in turkey, but the tryptophan in turkey does not seem to get transformed in the intestine into serotonin. Soy foods, cheese, seaweed, that kind of thing. Okay, so serotonin syndrome is a toxic level of serotonin. It's pretty rare, but it can be life-threatening. It's most likely to occur with people on antidepressants. So if you're increasing doses, Prozac goes from 10 to 80 milligrams. Most people take 10, which probably doesn't do anything. at least in my experience. 20 seems to be helpful, although I've taken 20 milligrams of Prozac before and didn't do anything. I felt nothing whatsoever. The reason is for depression or depressed affect, the success rate for Prozac, Zoloft, Paxil, all the ones you've heard of, is 20%. Okay, so it's not really that effective. And I mean, tons and tons and tons of Prozac back when it was expensive. It's off patent now, so fluoxetine is the generic. It's about $16 for 30 days worth. So it's really inexpensive, kind of like Xanax is cheap. I don't think Prozac is addictive. Xanax is highly addictive. Okay, the other things that can raise serotonin medically or medical stuff is Demerol. So anybody that's using Demerol routinely, so chronic pain syndrome patient can be on Demerol orally. Dextromethorphan, I can never say this, that's dextromethorphan, which is in cough medicine. Migraine drugs known as triptans, dietary tryptophan supplements can do it. St. John's wort can do it, and that's used as an herbal supplement for depression symptoms. And then Garcinia cambogia, it's tropical food, it's fruit, it's used in weight loss for appetite suppressant and weight loss supplement. So you got to read the labels on all that stuff. So the symptoms usually occur within minutes, few hours, and may include tachycardia, so fast pulse, high blood pressure, heavy sweating, tachypnea, which is rapid breathing, agitation, restlessness, hot, dry skin, counteracted with shivering and goosebumps, headache, diarrhea, dilated pupils, nausea, vomiting, rigid muscles, twitches, tics, loss of coordination, confusion, and even hallucinations. So it's an interesting neurotransmitter, and it's an interesting thing to talk about because people, with low serotonin levels think it's all about depression, and it's not. And then they take Paxil or Zoloft or whatever one you want to name, and they only get a 20% improvement rate. So if you take a fluoxetine, comes in 10s and 20s, a 40, and I don't think they make an 80 milligram pill, but you take 2 40s. If you get all the way up to 80 milligrams, you're probably going to get the side effects of too much serotonin in your synapse. So I will put up a little link. That necklace, Linda Rash asked me about that necklace. It's an Etsy necklace by a lady named, it's called, let me see here. It's called, can't think of the name of the it's on Etsy. And I can't, it's molecular something or other. Yeah, Molecular Muse on Etsy. And she's got dopamine necklaces, and she's got serotonin necklaces and earrings and all that kind of stuff. You can spend like a whole gang of money on a 14 karat gold serotonin molecule necklace. It's about $350. The one I put up is like $30, sterling silver. Anyway, I'm going to be out of town, and I'll probably have to do the Wednesday, Friday classes on my phone. So it'll be kind of interesting. And I had to do that a couple weeks ago, and I didn't like the way it looked. But anyway, you guys have a great day. Peace and health to all of you, and I'll talk to you Wednesday morning, maybe about brain chemistry and depression. All right, see ya. Bye.